Okay. Good afternoon. A warm welcome from Nairobi. It is 3:30 in the afternoon now. I would like to extend a warm welcome to all of you who are joining us from all corners of the globe, from different countries, to hear about violence against children. In 2006, there was a study done at the UN on violence against children. And now we're almost 15 years down the line. And so what has happened since that study? We have a very, very distinguished panel with us today. We're very privileged to have with us Dr. Maya Gillespie, who will share her reflections on the 2006 UN Secretary General study. I will introduce her in more depth later, who will reflect on the study, the process, and what has happened since then. Just a few thoughts. We also have Dr. Jillani from Pakistan, who will be talking about one of the contexts in which violence takes place, which is the work context, the whole issue of child labor in South Asia. And it is very much an issue not only in South Asia, but also in Africa and other parts of the world. We also are very, very happy to have Caroline Muhwezi, who will talk about why child participation is critical if we have to stop violence against children. And last but not least, we have Dr. Najat Majid, who is the UN Special Representative on Violence Against Children. She will talk to us about the roadmap to protect children from violence in response to COVID-19. But we also have here with us, behind the scenes, we have our technical team, Ali and Karoro actually was live streaming this from Japan. And then we also have a team of moderators, a whole number of young people who are supporting this process. And in this room with us, I have my co-moderators. There is Halima Dolif, who is a child leader. She started her activism at the age of 14, and she's still young. She's in first year at the university in Kenya. And we have Declan Magero, who is an associate of Jaslika. And I am Sheila Wamahio, who will be your host today. So thank you once again for coming. Before we start, we have a few ground rules, which I would like Declan to take us through. Declan, over to you.
Thank you very much, Dr. Sheila. And it's a great pleasure to meet everyone and look at a fantastic discussion. But to ensure that, this runs properly, we'll adhere to the following guidelines for everyone in attendance. So first is, please refrain from making comments that do not relate to the topic or to what is being discussed by the panelists. The other one is the chat can also be used to ask technical questions. For example, if you're having issues with the sound, please feel free to ask about it in the chat section. You can also direct your technical questions to hello@jaslika.com. If the problem can realistically be resolved during the course of the webinar, then our team will do what they can to resolve it. You can still write, you can still write in your questions throughout the presentation. Your questions will be compiled and passed on to the speakers at question time. We encourage questions from all our viewers. When asking a question, please tell us where you're joining us from. That is the city where you're tuning in from, and the country as well. and your work or institution of affiliation, if any. If you're a child or a young person, please do mention it when posting your question as well. Jaslika is guided by values of respect and diversity. Therefore, any inappropriate comments will not be tolerated. If you make any inappropriate comment, you will immediately be removed from the chat of the webinar by our team of moderators. Inappropriate comments here include, but not limited to, personal insults, comments that are tribalist, racist, sexist, homophobic, ageist, or ableist. We are reminding you that we're also recording the webinar. I wish you all the best and looking forward to this. Back to you, Dr. Amaya.
Thank you so much, Declan. According to a UN study that was published this year on violence against children, violence affects the lives of up to 1 billion children globally, with long-lasting and costly, very costly emotional, social, economic consequences. Our expert panels today will discuss this issue, approaching it from different dimensions. First, on our panel, it will be Dr. Maya Gillespie, who is joining us all the way from Australia. And we really appreciate it because it's late into the night now. It's about 10:30 p.m. there. But she has kindly agreed to join us. Dr. Gillespie was the director of the UN Secretary General study on violence against children in 2006, which sparked the global momentum that we see now on this issue. The study was a channel for advocating to and with governments and across the UN system and the countries, along with a very active NGO coalition, which proved critical. The success of the study was not only at the diplomatic level, with the appointment of the first special representative of the Secretary General on violence against children in 2009, but also in terms of programs on the ground in every region of the world. Prior to this, child protection was seen as a complicated field, with almost no evidence to support effective, grounded intervention, and even less political will to do so. Amaya's grounding in public health and behavioral science has been the common thread throughout her career. She has a reputation for strong communication and social justice advocacy, as well as for leadership in complex emergencies and pandemics, such as HIV, Ebola, and COVID-19. Amaya is an accomplished international executive and career coach, specializing in resilience and leading through complexity and uncertainty, and also an adjunct professor of Queensland University of Technology, School of Public Health, Australia. She has a PhD and Master's in Public Health, Behavioral Science from the University of Oregon. And I can vouch for the passion of Amaya. Amaya is very, very passionate about the issues of children. So Amaya, over to you for your reflections. Thank you.
Thank you so much, Sheila, and it is really a pleasure, but also a privilege and an honour to be among these friends and colleagues for me this evening. So my role in this webinar really is to take us back a little bit in time, and as difficult as perhaps it seems right now with the challenges in front of us, I guess I want to take us back to when the real global push around violence against children really got started, and that was with this idea of the study that Sheila just spoke about. And I know it's hard to imagine, but when we started, this was in 2004, and I know this is very difficult to believe, but we had no iPhones. We actually did a global study. It was a global movement. We had an enormous effort all around the world. No iPhones. Yes, we had internet, but it was a completely different world. So trying to connect people, trying to get things to happen, it was really a very different time. And as Sheila has said, one of the main motivations of doing this study at that time was because there was so little attention to what UNICEF and a large number of NGOs like Save the Children and others had been advocating for a long time around child rights and particularly the protection of children. It was felt to be quite complicated and people couldn't really land on a definition and agreements. And really this idea of violence was put forward, violence against children, as a way of trying to understand and simplify child protection. And of course, that is because, unfortunately, everybody understands and everybody has experienced some form of violence. So the study actually got people to talk about what is our definition of violence. And back at that time, sure, everyone agreed that sexual violence was a bad thing, that certainly the trafficking of children and exploitation of children was a bad thing. But they didn't necessarily agree that, say, bullying or calling someone names can you really call that violence? So people were very stuck in the idea of physical violence, and I know that is still quite a challenge, is to get people to understand this huge spectrum that is now really accepted as violence. And this whole concept of, on the one hand, that it was good that people understood violence against children and people had experienced it. So we got a certain amount of buy-in from the beginning because everybody had the experience. But there was actually a downside of that because some people, particularly around the common sort of violence like bullying and corporal punishment, some people stood up in public forums, and these would be, authorities, people who were very respected, would say, I don't think it was such a bad thing. I was bullied, or I was subject to corporal punishment, and look at me now. So we really had to work hard on our advocacy, on our arguments, on connecting to people and trying to get them to really think a little harder and differently about the things that they were saying, and also about what people had accepted as child rearing practices. So it was a really interesting time. And just briefly in terms of what the survey involved, because I think it really made a critical difference, the elements of the study, I should say. And it really was a mobilization. It wasn't really like a survey where somebody just did one piece of research. It was really a huge mobilization. Governments submitted themselves, made submissions, and we had every region of the world and a huge majority of countries submitting. The government submitted voluntarily. We had thematic reports around particular issues, and people like Jillani, he was with us as an expert at that time, helping us with particular issues. And we had a regional consultation in every part of the world. It was a huge effort, and very much, it was very, very important that we had NGOs involved in that. I should also say, and just mention briefly, that there were 3 UN organizations who were involved. And again, I think this is important to the way that the study unfolded, and it's important in terms of leadership. There was, the study was 3 organizations together. It was the World Health Organization, which of course is the seat of global evidence and setting standards. And at that time, we really had very little, if anything at all, that you could call a global standard around violence. It was just so untouched. We had the Office of the High Commissioner on Human Rights, and of course, they were taking a rights-based approach. And actually, the Convention on the Rights of the Child was probably the most formal document we had to really go on, and it was a very important part of our argument and our advocacy in the absence of empirical evidence. And of course, the third organisation was UNICEF, which had the people on the ground, a lot of experience on the ground, and a lot of case studies, a lot of those stories that we could talk to the world about in terms of the need, and also to start to get conversations about what to do about it. So there's three things I'll just highlight, and that I think were really critical, and I think it's still critical around moving even further from where that study got us started. The first is that study really showcased the participation of children and adolescents themselves. Something that people had dabbled in. It wasn't that it had never been done, but it hadn't been done on a global scale, you know, where every region was represented. Disability, older adolescents, younger children, you know, real effort from rural, urban, real effort, which again, thanks to the NGOs who are involved. And that was this concept of, which I think probably originated from the social mobilization around HIV, this concept of, you know, nothing about us without us. And the children and adolescents really made such a big impression. So important to have them involved, because even if at the political level we want to argue about what's important and what's not important, it's very difficult to argue into the face of a child about their own personal experience. The second thing I would say, and I still think the participation of children and young people and people affected by the issue is very important. The second thing that I think was a big issue then, and it's still one of the most important things we can do, is to get ourselves better evidence. When we started, there was little to no evidence. You have to have the data, not just to tell the stories of people's experience, but to tell it in a collective sense, and to be able to sit at the table with the people who hold the purse strings, the people who have the cash. They want to know where this issue fits in the larger sense, and the empirical evidence is so important. It was very important for our advocacy. It's very important for convincing donors that this is as important as other things. And it's very, very important for us to be able to talk about intervention. So initially, the data that was collected was describing the problem, and we didn't have so much to say about the solution. That's an untenable situation. It's really so important to be able to move from problem to solution, and only empirical evidence can really get you there at scale, you know, and I think that's like still a really big problem for us to be able to push to scale. And so just thirdly, the last thing I would say and I'm just sort of cherry picking a couple of things that I think were important then, that got going then and are still important. And the third thing is leadership. And of course, having good evidence is also important for leaders to be able to speak with confidence and to be able to attract attention. But the study also was the impetus for establishing the UN Secretary General's first special representative on violence against children, and that was under Kofi Annan. And of course, we have the wonderful Dr. Najat now to carry on with the progress that is being made. So that's a little walk around memory lane. Hopefully, it helps you feel like we've made quite a lot of progress to think about where we started. Yes, there are still some big challenges, but I do think we have moved forward in a very big way around collecting more data, about having more solutions, having very strong leadership, and also maintaining the momentum with the participation of children and young people. So I'll pause right there, Sheila, and back to you.
Thank you so much for that, Amaya, for giving us the background and a bird's eye view of where we were when we started with the study on the 2006 study on violence against children, the lack of evidence at the time. And the whole process was a very empowering process, because it was just not doing a survey, a cold quantitative survey, but it involved people. And most importantly, it involved children and young people in this whole process. So I think I don't want to say much because you have laid the setting really for the discussion that's going to follow. You mentioned Dr. Anis Jillani, and we are very privileged to have Anis, Dr. Jillani with us here today to share with us some of his insights from South Asia on the whole issue of child labor, which still persists. The 2006 study highlighted some of the challenges. So we would like to know from Anis, where are we now with child labor in South Asia? Anis is a practicing lawyer, in addition to being an active board member of SPARC. SPARC stands for Society for the Protection of the Rights of the Child. Anis has done his Juris Doctor, or JD, from the US, and master's from the UK, and another master's from Pakistan, which is where I knew him first. He has written several books on issues relating to child rights, including Child Labor, the Legal Aspects, a book on the legal aspects concerning child labor in both Pakistan and India. It's Cries Unheard, Juvenile Justice in Pakistan, a book on the issue of juvenile justice in both Pakistan and India, as well as Child Rights in Pakistan, which is a book covering all features relating to child rights, with a special emphasis on the UN Convention on the Rights of the Child. He has also written Pakistani Laws and the Convention on the Rights of the Child, a book that compared in detail all the child-related laws of Pakistan in relation to the UN CRC, and that partly prompted the government of Pakistan to sign and ratify the Convention on the Rights of the Child. And as well as, and he's written and he's done a lot of advocacy work, a lot of, and in terms of the evidence that Dr. Gillespie was talking about, he has contributed to generating that evidence to support advocacy and intervention on the right of the child. So I would like to hand over to Dr. Jillani now to take us through his perspective on child labor and the issues around it. Dr. Jillani, over to you. Dr. Jillani, your microphone is muted. Maybe there could be a problem with technical problem on his side.
Yeah, I think his mic is still muted.
Yes.
He must unmute
Yes.
the mic.
Can you unmute your mic, Dr. Jillani? Okay, as we sort that out, maybe we can move ahead and bring Carol. Carol, you're there?
Yes, I'm there. Though the mine has a mix with another platform, but let's see if the tech will allow us.
Okay.
Yeah.
So let me introduce Carol in the meantime, and then by that time, hopefully, Anis will be back. So Carol, I'm very proud to introduce Carol. Carol was 14 years old when she started her activism. She was determined, as Amaya said, nothing for us without us. She took that in a very literal sense. But now Carol is the UNICEF Nigeria Generation Unlimited Program Specialist. She's a lawyer and a registered advocate of the High Court of Uganda. with a master's degree from the University of Leicester in Communications, New Media and Society. She has a wealth of experience in working with and for children, and as a child, as I've said already, and young people that started with her participation in the first UN General Assembly special session on children in 2002, where she represented her country in developing the World Fit for Children document. Caroline has over 8 years served as the youth participation consultant for UNICEF in Uganda, working with school clubs and youth networks, empowering hundreds of young people across 25 districts through skills training and back to school programs. She was instrumental in the initial setup and running of U-Report Uganda in 2012, U-Report Nigeria from 2014, and U-Report On the Move in Italy in 2017. She's passionate about working with young people. She's still a young person. And especially education, especially for the girl child, and most marginalized and advocating for them. In her free time, she said she loves to travel, take photographs, listen to music and dance, which is all true. So, so we have introduced Carol, but I can see Dr. Jillani is back. So let's do it this way. We give Dr. Jillani his...
Okay, thank you.
Just a minute, Anis. We give him the opportunity, and then Carol, you can come back. I want to introduce you. We'll go straight into your session. So thank you. Thank you, Dr. Jillani. I'm glad you've been able to resolve your problem. Yeah.
Can everyone hear me?
Yes, we can hear you.
Okay, it's a privilege to be here, and thank you for inviting me to be part of this. I'll mainly be talking of child labor. I'll be talking of the situation in Pakistan, but the situation in the other South Asian countries, it's not very different from what it is in Pakistan. Pakistan is the 5th most populous country in the world. You know, it has a population of almost like 210 million people now. And the growth rate remains one of the highest in the world. Not the economic growth rate, but just the population one. Unfortunately, it's also one of the poorer countries. Almost 1/3 of the population is living below the poverty line. And we all know that poverty is one of the main causes of child labor. Roughly speaking, you can say there are about 90 million children in Pakistan. You know, I'm sure all of you will know that children is everyone who is under the age of 18. The sad part is that with so many children, the number of children going to school is low. You know, if we take, we don't have figures for the whole 5 to 18 years, but with the figures we have for 5 to 16, we have almost like 23 million children who are not going to school. So it's a huge number. You know, it's more than population of most of the countries in the world. And I hate to say this, but we don't appear to be doing much to solve this problem. We have a provision in our constitution which says that it's the state's obligation to provide free and compulsory education for all children in the age group 5 to 16. So it's like a fundamental right of every child in this age group 5 to 16 to have education. Despite this, 23 million children, they are not going to school. And, you know, when we say these children are not going to school, the question then comes up that what exactly are they doing? I'm not saying that all these 23 million, they are working, because right now, especially after COVID, you know, the unemployment has gone up. But despite this, you know, these children who are not going to school, they are either working or they are at least helping their families with work, because 65% of the population is living in the rural areas. So many of these children, they are helping their mothers, helping their parents in the fields, you know, what one can regard as informal sector. Uh, Presently, there is not much which is happening in Pakistan as far as the government is concerned to address the problem of child labor. Uh, it's taken up, especially children who are employed as domestic child laborers. This issue is once in a while picked up by the media, particularly when you know, one of the child is abused by the employers. Many of these children, almost like 20 to 30 children each year, they die at the hands of their employers because of violence. So whenever such an incident takes place, the issue is picked up by the media, but then nothing happens. I would like to mention that domestic child labor remains legal in Pakistan. So the employers, they can even employ children as young as 4 or 5 year old children um, to be working in homes. And it's a pathetic sight that lots of times you find these very young children, especially girls, you know, carrying infants in their lap. Lots of times when you are in restaurants, you find that these young girls, they are carrying these infants while their employers, they are enjoying their meal. And the girl, she's just looking after the infant, and she's not even eating in the same restaurant. Uh, the condition of these girls is not good at home. Uh, Most of the time, they are sleeping on the floor. Uh, yeah, they have long working hours. It's like they get up early and they are one of the last persons to sleep at home. So, you know, this is an issue which I think needs to be addressed very quickly. But, you know, lots of organizations, they have been raising voice about the issue, but unfortunately, there is resistance. And the resistance is for the simple reason that almost every second or third household in Pakistan is employing children as domestic child laborers. And especially the educated class, especially the urban class, especially the bureaucrats, people who have to make these laws, they are the very people who are employing these children. Uh, Apart from these domestic child workers, then we have children who are self-employed. They are children who are like garbage collectors, what sometimes are called rag pickers. It's a common sight all over Pakistan to see these children rag picking, sifting through the garbage for paper, for pieces of plastic or iron. So then there are children who are sitting in the markets offering to polish people's shoes. There are children who are selling goods like balloons or other stuff. So this is another issue which is ongoing. And just like the domestic child labor, there are no laws which govern the self-employed children also. So again, this is an area which needs to be covered. And the third important area which is not covered by any laws are the children who are working in the agricultural areas. So these are children who are working in the fields, helping their parents, girls helping their mothers to cook or looking after the siblings, but no laws to govern them also. So, in other words, one can safely say that child labor to a large extent is not covered by the laws. And the situation is not different in most of the other South Asian countries. It's somewhat similar. So it's not just Pakistan. Since I am from Pakistan, so I can talk about the country, but what I have seen in other South Asian countries, maybe with the exception to an extent of Sri Lanka, I think in the remaining South Asian countries, the situation is bleak. Of course, in India, it's very severe because of the numbers, with a billion plus population and with huge poverty levels, the situation is bad. Now, we are concerned and we are talking presently of violence against children. So these children who are working, they of course face violent situations. They are emotionally abused, physically abused. Lots of times they are sexually abused also, especially when they are living in their work environment, like domestic child laborers, children working in small restaurants. So these children, they are abused also. Now, the thing is, I think we all know that child labor is caused by poverty, but we all must remember that poverty is also caused by child labor. So it's like a vicious circle. If you want to end poverty, if you want to finish poverty, then I think there is a need to end child labor. Uh, I don't see a scenario where you can achieve ending poverty without uh, banning child labor, without placing restrictions on child labor. It's not possible. Because you cannot expect these children who are working to, be educated, to change their economic status, and they will remain poor all their lives. Then their children will be poor. So it's a vicious circle, and I think it's for the state to intervene to help the vicious cycle of poverty amongst these families. There is need for quality education to be provided to these children. It's not just education. It's very important that the quality of the education should be, ideal. Otherwise, if these children, they go to school, but they are not getting satisfactory education, then I don't think it will really be useful. There are laws like other South Asian countries, which to an extent regulate child labor in the formal sector. But one of the problems is that most of these laws, they cover places like factories or mines, and the cutoff age is 14 years. So it's not 18, but 14. So this leaves a huge chunk of children in the age group 14 to 18 totally exposed. So even places like factories and mines, shops and establishments which are governed by laws, even these sectors, they can employ children in the age group 14 to 18. Pakistan is a federation, uh, just like India. So it's a provincial subject. So the center or the federal government, it doesn't have so much say, although it should provide the guidance despite it being a federation. But the lead has to be done by the provincial or state governments. But presently, it's presently, like, there is not much happening in Pakistan. If you go to the labor departments, if you ask the relevant officials what exactly are they doing about child labor, they will not have much to say. There is really nothing happening. 23 million children not going to school. Despite this, no action being taken to ensure that these children go to school. A sizable number of these 23 million children working, no action being taken by the government to control this. So it's not a very rosy picture, unfortunately. I think a lot needs to be done. And I will like to mention that there is resistance also. It's like lots of times when you raise the issue of child labor in Pakistan, there is resistance, and people criticize you, saying that you are uh, affecting the national interests, and it's not good for the country that you are raising this issue of child labor. Especially the export sector is very touchy on this issue, because they feel if this issue is raised, then it will affect the country's exports. So they are very defensive. They are defensive when it comes to providing information, when it comes to taking action, but they are not doing much. So lastly, I would like to just mention one thing, because I've been working in this area for decades now, that many of the donors and major donors also, they have these projects that, okay, we have a project, which will be benefiting, say, 1,000 children. So they will be spending millions of dollars working with, say, 1,000 children. Lots of times the number is even less than 1,000. The question is, when the numbers are so huge, what miracle are you expecting by working with 1,000 children? 1,000 children probably have been added to the country's population while our webinar is taking place. So this project approach is not working. It has to be done at a very macro level, and on advocacy is important. I think the governments, they need to be convinced that they have to do, introduce laws that prohibit these things, that prohibit violence against children, that ban child labor. So, it has to be done on a much bigger scale than just working with a few dozen children. Thank you.
Thank you, Anis, for that. It's for at least ending on a note where you're giving some concrete suggestions for moving forward. It is very unfortunate that very little is being done in some of the countries in South Asia, including Pakistan, where I'm from. But I hope that there will be more advocacy and the political will, for the political will to change that over. You've highlighted gaps in law. I think that's very important. You've talked about the vicious cycle of child labor and poverty, and the importance of taking interventions to scale, to stop having a very micro project approach and look at the wider picture and have more strategic interventions. Maybe the other questions we will ask later, but for now, I think we will stop on that note, because we would like to hear from Carol now, whom I've already introduced, so that she could talk about another strategy, which is actually involving children, meaningfully involving children and youth in trying to break that vicious cycle that you talked about. So, Carol, over to you.
Okay. Thank you very much, Sheila. I'll appreciate those if you can confirm once I start playing the video to be sure you can hear it. So I'll just go on to present and then share my screen. So, okay. Sorry, just 1 second. I hope the tech lets us. Okay. Oh.
Children to be given a forum in which they can express themselves. The best way governments can cause development in their countries is by listening to children. For instance, look at all governments in the world. When the president needs to know something about health issues, he'll call doctors, nurses, and people who are related to the field. Why is it that when they need to talk about children-related things, like child trafficking, for example, or abduction of children, they don't involve children? And yet these are the people who are very important. They know how best they can make their future worth a living. So I think child participation is essential. It's not a privilege, it's a right. Children have a right to express themselves freely on matters that concern their well-being. I'm 6.
Okay. So I'll just stop there and pick up from that quick short video. So as requested to speak about why child participation is very important, and I felt who better can summarize it than a child themselves. So a child speaking from their own experience in terms of what does child participation actually mean and what does it feel like to participate. Sheila briefly shared my story with you. And what would be interesting to know is actually I'm the child in that video at 16, and this is almost 19 years later. And I'm here today to still speak about why is child participation important and why does it really matter. So child participation, like the video well articulated, it's a right and not a privilege. Children have the right to speak out, but every time you're thinking of children speaking out, children oftentimes also say, we don't want to just speak out, want to be sure that we are heard, want to be sure that we are listened to. But then also when you're looking at child participation, you're looking at it varying relative to the age of the child, relative to where the child is. So it's not a one size fits all kind of thing. Different forms of participation will vary depending on whether the child is a 6-year-old will not perceive sexual harassment the same way a 16-year-old would. And it's very important that as we encourage children to participate, as we give them platforms and forums to participate, we're very cautious of their age, their setting, where they are, and really listening to their voice and understanding their language, their kind of language. But then also this doesn't take away from the different settings that you have for child participation. You'll find young people, children on the move, children in conflict affected areas. Dr. Anis has been speaking about children who are going through child labor. A lot is being said about, right, children in school. Sheila had earlier spoken about those who are bullied. So the contexts vary, the contexts are different, and it's very important that in those different contexts, you still pay attention to what's the capacity that that child has to participate. Give them the forum and then listen within the capacity in which they have. I think that's also very, very important. But then it's also important to take note of also the social and cultural norms, which at times make it hard for especially girls to participate, especially if it's in a family where maybe the boys are more listened to than the girls, then the context is a bit different. So how do you then motivate such children to still be able to speak out and comfortably express themselves, especially when it's an issue of violence or it's an issue where you feel they're not feeling safe or they're not feeling protected? Is it better to go through a school club? And that's why we hope and we're pushing for safe reopening of schools, because for some children, maybe that's a safer space in which they can be able to address violence against children. So before I conclude, I would also want to share with you some of the avenues in which children themselves can participate, especially the children and young people on this call, and sharing also with you from my experience. Currently, I'm working with Generation Unlimited, which is being championed by UNICEF and partners to be able to encourage young people in skilling and training as well as learning. Now, you'll find so many children who are out of school, oftentimes maybe the children who are living on the street, they're exposed, they're at a greater risk of being exposed to violence and to violence. And it's important that as we encourage them to get into learning, whether to get into skilling, then you're protecting them better. You're putting them in a safer space than if they're just on the street or out of school. But then also it's very important to highlight some of the platforms we've used, for example, through UNICEF's message-based platform called YouReport, which is giving young people right now in 70 countries, 11.5 million young people have registered to be able to express themselves using SMS and social media. I know there's a lot said on safety online, but still taking heed to the precautionary measures, young people have comfortably been able to report violence in their community or in school using this YouReport platform. Very powerful. And right now, this is in 70 countries. In Nigeria, for example, where I am today, it's over 3.7 million young people registered on that platform. In Uganda, where I come from, it's over 250,000 registered, and that's where YouReport started from. Then also looking at storytelling and art, there's a book that has been published where young children are sharing their stories in COVID-19. Oh, that's very powerful, especially when they're at home. What can they do in their safe spaces when they're at home, keeping in mind that this is during COVID, but yet at the same time also encouraging and really advocating for the safe reopening for schools, because you won't take away from that child who their safe space is a teacher or maybe the patron of their school club, or even just peer-to-peer support, just knowing that I have 6 other friends in my class who I can talk to, maybe better than maybe a brother at home or a father who I'm scared of telling something, So really just being open to the broad spectrum of child participation and child engagement. And lastly, I'll also emphasize the fact that children will only participate when they also have the right access to information. Are you giving them the information that will help them participate better? Do they know it's their right? A lot is said on CRC, but do they even know how friendly a right is? Like, do they have a friendly version of it? So give it bite-sized information which children can take in and just believe in them. And I'm speaking for all, people on this call probably are the advocates of what I'm asking for, but I mean everyone out there, making it just a joint effort and knowing that it's a collective responsibility to end violence against children and to ensure that child participation is part of it. Yeah, thank you.
Thank you so much, Carol, for that very powerful presentation. And ending on the note that it is our collective responsibility to end violence against children. You have given us some very interesting pointers on how children can participate, practical steps that we can take based on the evolving capacity. and the U report that you've talked about as a channel for reporting on violence and other issues too, storytelling and art, and asking the question whether giving them the right information so that they can actually participate in a meaningful way. So I think that's a very powerful statement, and I'm sure there will be many questions for you after this. With that, I would like to now turn to Dr. Najat. Dr. Najat Majid. And I think we're really very, very privileged to have Dr. Najat with us today. She accepted the invitation very readily, and even though it's quite early in New York now, when we started. So Dr. Najat was appointed as Special Representative of the Secretary General on Violence Against Children on May 30th, 2019. As a high-level global independent advocate, Dr. Najat promotes the prevention and elimination of all forms of violence against children in all settings, including online and offline, the justice setting in the home, in schools, in institutional care, and even child labor, which is the workplace, the community detention centers. She acts as a bridge builder in all regions and across sectors and settings where violence against children may happen. By profession, she's a medical doctor, pediatrician, pediatrics, and she has over the last 3 years devoted her life to the promotion and protection of children's rights. She was head of the pediatric department and director of the Hay Hassani Mother-Child Hospital in Casablanca, Morocco. She's a member of the Moroccan National Council on Human Rights and founder of the non-governmental organization Beiti, the first program addressing the situation of children living and working in the streets of Morocco. From 2008 to 2014, she served as UN's Special Rapporteur on the sale of children, child prostitution, and child pornography. Dr. Najat also worked as an expert consultant for national and international projects, strategies, and policies relating to child rights promotion and protection. She has participated in the development of national policies on the protection of the child and has worked with several governments, non-governmental, and intergovernmental organizations. She also has vast experience as a lecturer in Moroccan and international universities on child rights protection, promotion, programming, and monitoring. A member of several regional and international NGOs and networks working for child rights, Najat Majid has also been involved in the training of social workers, law enforcement, teachers, judges, and medical staff. She holds a doctorate in general medicine from the University of Rabat, a specialization in pediatrics and neonatology, I hope I pronounced it correctly, from the University of Bordeaux, and a Master of Human Rights from the Human Rights. Really privileged, Dr. Najat. Over to you.
Thank you. Thank you. Good morning and good afternoon. And I hope that the technology problems will allow me really to deliver this some main points I want to raise with you. I want really first like to thank you and Jaliska and Amaya that I knew since many, many years for organizing this webinar focusing on child protection from all forms of violence in the context of the pandemic and mainly focusing on the global south. And I just want, before starting, jumping on 3 points highlighted since the beginning. One by Amaya regarding the follow-up of the global study when Sergio Pinero was highlighting that no violence against children is justifiable and all violence is preventable. And since this 2006, and we had also on 2015 the agenda for sustainable development, when we have a big SDG 16.2 that on ending violence against children by 2030, just I want to let you know that we are not on track to achieve, the full recommendation of the global study and to achieve also the SDG 16.2. And with the pandemic of COVID, we are still not on track to achieve it. I want also to come on the point raised by Caroline regarding child participation and engagement and your report, and just to let you know that child participation and engagement and peer-to-peer and seeing children as part of solution as is one of my main priority and the cross-cutting issue. And I am so happy to hear you speaking about your report, because we use it also regarding, all this COVID under 19 initiative. No, I will focus on what I asked to do. All of us already know the risks posed by COVID-19 crisis to children are enormous. The COVID-19 crisis has a potentially far-reaching long-term negative impact on children around the world. In the words of the Secretary General, what began as a health crisis risks evolving into a broader child rights crisis. To date, you know that 188 countries have imposed countrywide school closure, affecting more than 1.5 billion children and youth worldwide. And we know that also COVID-19 exacerbated the risk of maltreatment and being exposed to violence at home. We know also that this pandemic is global, moving, difficult to control. Some countries slowly begin to emerge from the intense crisis phase of the COVID-19. Many countries are still facing waves of infection that require forms of lockdown to be reintroduced. We must assess the direct impact it is already having on the vulnerability of children to violence, as well as the potentially profound and lasting damage it is doing to already weak prevention and response capacities. The continuing toll of violence against children is undermining progress across the SDGs. We must ensure that the impetus the 2030 agenda has given to comprehensively addressing violence against children is not stalled by the pandemic. We know that the COVID-19 pandemic is globally harming children worldwide, with the poorest and vulnerable children hit hardest. While the data we have so far is only indicative, the mitigation measures taken in response to COVID have heightened the risk of violence against children. The pandemic and its mitigation measures have increased the risk of children to experiencing or being exposed to violence at home due to school closures, confinement, movement restriction, disrupting provision of already limited child protection services, added family stresses related to job loss, isolation, and anxieties over health and finance. We know also that child abuse is less likely to be detected during the COVID-19 crisis, as child protection agencies have reduced monitoring to avoid spreading the virus, and teachers, social workers are less able to detect signs of ill treatment. Widespread digitalization mitigates the education loss caused by school closure, but the poorest children are least likely to live in good home learning environments with internet connection. And it seems also this widespread digitalization highlights also the big digital divide. Furthermore, increased unsupervised online internet use has magnified issues around sexual exploitation and cyberbullying. Europol has reported that law enforcement partners are reporting increased online activities by those seeking child abuse material as a result of COVID-19. We know also that children who are already vulnerable, including children living in poverty, children with disability, children in out-home care, children in detention, refugee, internally displaced children and migrant children, children living on the street, children in detention, children living in conflict areas are more at risk to be victims of violence, exploitation, and exclusion. Furthermore, the pandemic has the potential to create new vulnerable children, and countries must prepare to respond to growing needs for support, and mainly the low income and developing countries, mainly in the global south. Another main point that I want to share with you, we know that this COVID also pandemic harms children's mental health. The stress and uncertainty associated with the COVID-19 outbreak potentially has significant negative effects on children's mental health. In various consultations of children undertaken by CSO, and Caroline highlights some of them, children expressed that they feel unsafe, insecure, scared, lonely, and isolated. We know that toxic stress and anxiety have negative and long-lasting effects on children's mental health, including sleep and eating disorder, post-traumatic stress disorder, depression. At the same time, COVID-19 outbreaks present serious challenges to the delivery of mental health services, including for children having disability or mental health difficulties before the pandemic. Regarding the global south, and I think it's really important, and I want to highlight that, we know that the global post-COVID socio-economic crisis will increase child poverty and vulnerability to violence, and mainly in the countries, the low income and developing countries. The World Bank recently estimated that up to 100 million more people may be forced into extreme poverty, affecting the most vulnerable children and women, and in the most vulnerable countries. The ILO reports that a 1 percentage point rise in poverty leads to at least a 0.7% increase in child labor in the low and developing countries. And we know that poverty is a driver of child trafficking, sexual exploitation, and recruitment of children into criminal gangs, armed groups, and forces. We know also that poverty also increases the risk of marriage, child marriage, and the UNFPA projects that an additional 13 million child marriages may take place over the next 10 years. And sure, the global south is most affected, and mainly the countries that are low income or in a crisis situation. And why I want to highlight that this impact, and mainly in the south countries, will affect not only health and economies, but also peace, security, human rights, and humanitarian assistance. And we know that the COVID-19 pandemic will hit global south not only as a health crisis, but also as a devastating socio-economic crisis that may persist over the years to come, and that will highly exacerbate the vulnerability of children to violence, exclusion, and discrimination. We know also that the COVID-19 pandemic threatens to reverse development progress made by countries to fight poverty. And this COVID-19 economic aftershocks will derail the progress towards poverty eradication and will increase extreme poverty, affecting millions of children. But what we know regarding also the South countries, and mainly the low income and developing countries, that COVID pandemic is not only responsible of all that, but is exacerbating existing vulnerability before the crisis. Many countries really of the global South were facing challenges before the pandemic, including political instability, conflicts, radicalization, socio-economic disparities, informal economy, gender discrimination, climate change, migration, food security, harmful practices, weak health and child protection services, lack of social safety nets, and the list is very long. Many countries before the crisis were facing economic crisis with high level of debts. We know also that before the crisis, many children were experiencing various forms of violence and exploitation. And many children before the crisis were deprived of protective, healthy, safe, and nurturing environments. And we know also that this pandemic will have a catastrophic impact for the most vulnerable, and mainly children, because of the risk of sexual and gender-based violence and of grave violation affecting children, including in refugees and internally displaced person camps and conflict-affected areas, have risen. Violence against women and girls, including domestic violence, is escalating as the pandemic spreads. And I just want to remind you that the SG called for ceasefire on domestic violence because it has increased. The spike in violence in the home and harmful practices such as child marriage, sexual abuse as a result of the pandemic are not properly addressed. And the recruitment also of children by armed or violent extremist groups could be exacerbated. However, I want to have a kind of positive point. However, some countries from the global south have a wealth of relevant lessons from dealing with previous HIV, AIDS, and Ebola epidemics on engaging communities, communicating risks, and adapting local and innovative methods to craft, mainly in the African context, to craft African approaches to control spread of the disease. This is a clear opportunity for the continent and mainly Africa to build responses that integrate lessons learned addressing epidemics. Some countries from the global south undertaken in close cooperation with other key stakeholders mitigation measures, including, for example, accelerated adoption of technology and multimedia platforms for learning. In the future, it provides a mean of widening participation to population segments that have traditionally been excluded from learning, such as children in hard-to-reach areas and children living with disabilities. Measures to ensure well-being of children and their family, like child allowance in stimulus packages for households. Implementation of child protection mobile units who go and visit children in their homes, which can definitely be strengthened also by including a police officer and securing that all professionals have access to equipment they need to protect their health. Special protocols to protect children deprived of liberty that has resulted in an increased number of children free from deprivation of liberty. According to UNICEF, at least 31 countries have urgently released children in connection with the pandemic. For example, Indonesia has released almost 1,000 children, resulting in 50% decrease in the children detained. Mozambique released almost 1,600 adolescents and youth, and Bangladesh released 400 children. South Africa announced that parole and release of vulnerable population from detention will be soon in place. We have also other action taken to support parents in the upbringing of children and promoting, widespread awareness raising, targeting youth and young people, and strengthening also. We saw also some kind of strengthening of child helplines that are also good example. And at regional level, many things were done, having some kind of regional guidance to address children protection during and after the COVID-19 pandemic. But for me, what is important then to jump on what Caroline was highlighting, that even during this challenging time, children's resilience, activism, and sense of solidarity are remarkable. With the use of digital technology, children around the world are providing peer-to-peer support to help ease the stress they experience, taking their activism online to share safety information among their peers, volunteering to provide essential services to other children in need, organizing themselves around positive message, documenting their lives under COVID-19 to find commonalities regardless of geographical boundaries, and sharing online their experience with one another. Children are also identifying offline means to participate, to provide peer-to-peer support, even during measures of confinement and social distancing, like a radio program, caravans, and so on. But really I need really to highlight, much more needs to be done. It's time now to prepare for the current and immediate post-crisis phase of the COVID-19. Until a vaccine or a cure becomes widely available, there may be further, and we still see it, waves of infection across the world that require forms of lockdown to be reintroduced. We need to ensure that all the lessons learned on the violence-related aspect of the first lockdown are integrated into emergency preparedness now, including the development of protocols for service delivery and the protection of children's rights. Globally effective government response to the increased risk of violence against children must ensure that the social and child protection services are recognized as life-saving and essential services, along with health, mental health, and education as part of an intersectoral and child rights-based response. These services must be built on a solid foundation of a permanent social protection system reaching the most vulnerable and including universal child grants that will protect children and their caregiver from economic risk in good times and bad. It's also time now to prepare for the recovery phase. And we know that the coming budgetary crisis created by COVID-19 will have implication on all layers of the protective environment around children and will undermine progress toward reaching the sustainable development, including the target 16.2. This financial crisis will soon bring enormous pressure on government services, including for vitally important services for children. This will affect all countries regardless of their national income level. But in countries with lower aggregate incomes already coping with weak public services, the crisis will set back their progress for many years. We need to safeguard and strengthen child protection services as well as social protection during the recovery phase. We need to advocate with governments, donors, private sector, and civil society organizations to incorporate the strengthening of social protection and services for children into economic recovery package. The 2030 Agenda on Sustainable Development is a framework for our collective advocacy on ending violence against children. This year, the decade of action becomes a decade of recovery, focusing on building back better after COVID-19 while accelerating action and embarking on new pathway to realize the 2030 Agenda. Moving forward, how we can have a kind of practical and context-specific roadmap. On April 15, the UN Secretary General launched the UN policy to protect children's rights in the context of the COVID-19 pandemic. And building on this commitment, my mandate, jointly with the UN Interagency Working Group on Violence Against Children, launched an agenda for action that provides guidance on how to include child protection in the COVID-19 response, both in the short, mid, and long term. This agenda for action is available in Arabic, French, Spanish, and Russian, and give us a clear roadmap to protect children from all forms of violence during and after the COVID-19. And I can share the link with you in the chat. What is important in this agenda of action is, as jumping also on what Amaya highlighted at the beginning, more information is needed to reach the most vulnerable and to assess the impact. More cross-sectoral child rights approach are needed to have this multi-services platform, easily accessible to children when they are, and more solidarity and partnership. And I remind you that this year is the 75th anniversary of the UN, and it is about multilateralism and multi and bilateral cooperation that currently we are seeing not very efficient. To protect all children from all forms of violence in all settings, we need, and if we need to keep the momentum on preventing and ending violence against children, we need to continue mobilizing all key stakeholders, including children, at global, regional, national, and local level. To this end, we need to gather evidence and experience, documenting and demonstrating, first, far-reaching consequences of the COVID-19 crisis call for children and the right to health, education, and protection to be prioritized in the pandemic response and recovery planning. Two, recovery from the COVID-19 pandemic is an opportunity for governments worldwide to reassess priorities, advancing human development and reducing inequalities, especially for children, must be a major investment. Third, strengthening services for the well-being and protection of children is an investment in the future and will be the key to the economic recovery of states from the pandemic. Four, the high costs to the child and to broader society of not addressing social and child protection in the recovery phase. Five, the added value of considering children as part of solution and involving them in the immediate and recovery phase of this pandemic. Children's active involvement before and during COVID-19, whether online or offline, is proving that children can and are being part of the solution. Their inputs, experience, knowledge, and resilience are critical for building the post-COVID world. In conclusion, I want just to remind that we are at a crucial turning point in the lives of a generation of children who will be affected by COVID-19. We must do all that we can to ensure they do not become the main victims of the COVID-19 pandemic, but instead find a better world where their rights are promoted and protected and no child is left behind. And I just want to remind that solidarity, multi-stakeholder cooperation, and multilateralism, including children and involving children, are needed now more than ever. Thank you so much. Over to you, Sheila.
Thank you so much, Dr. Najat, for that very rich and powerful presentation. I think some of the takeaways, there are many takeaways from your presentation, but I think, to me, the whole issue of the added value of involving children and recognizing children's knowledge, resilience, and the solidarity and the creativity, if I may add,
Yes.
in solving this problem, the issue of looking at COVID, all these issues, I think all of you have talked about. These issues were there before COVID, but it has aggravated and heightened and brought about new vulnerabilities and new groups of children who, and other people and women who it is affecting. So, but using this as an opportunity to reduce, for governments, to reduce the inequalities by increasing investments in children. And of course, you've talked about the whole issue of collaboration, multi-sectoral, multilateral collaboration, partnerships, and all those issues, I don't think, and the importance of health, education, and protection, social protection, child protection. I mean, there's so many other things that you've said, which I possibly cannot summarize. But thank you very, very much for that presentation. I think what I'll do, so that we don't lose any one of you, because I know Amaya, it's late for her, I think I will go straight to the questions. And I'm going to give Halima the first opportunity to ask questions. As I've said before, Halima started her activism for children at the age of 14. So I will hand it over to her now. Halima?
Yes, Dr. Sheila, thank you so much for this opportunity. I'd like to thank everyone who spoke, and I feel like something is being done for children. And I'd like to bring to the attention of all of us that I have been sent by children to ask questions to these specific panelists. And I'd like to start off by giving a quote by Nelson Mandela, who says that history will judge us by the difference we make in the everyday lives of children. So I'd like to start with a question to Dr. Amaya from Saleh Khalif here in Mombasa. So Saleh asks you that in the surveys that are done concerning issues affecting children, how are children made safe from reliving the trauma when reporting cases of violence against them? How are their mental well-being catered for? So from how you spoke, Dr. Amaya, I could tell that the time the study was done was different from now, and now children are more sensitive to depression and from being labeled as having faced violence. If I can give an example, if a girl cannot just come out and say, I have been raped for fear of being labeled. So how is their mental well-being catered during these studies and during these surveys? I'd like to move on to Dr. Anis, who spoke a lot about child labor, and I have a question for you from Zamzam Hussein in Mombasa. I'd like to ask that according to Sigmund Freud, a famous psychologist, he said that from the age of 1 to 6 years is when a child is made or broken. So I believe that these years are most fundamental in a child's life. Zamzam Hussein is asking that children drop out of school to work and fend for their families at a really young age, as early as 6 years. How can we ensure that children are not out of school and that all children have access to education? Because it has come to our attention that as children, from a child's perspective, we do it as a form of duty, that our parents are facing financial issues and we have siblings that we need to take care of. So we put it on ourselves, which is a heavy responsibility for a child, that we have to work in order to sustain our families. So how can we ensure that children know that it's not their duty to be working and that they should be in school? The next question goes to Caroline, who has been really inspiring to me because I have also started advocating at a young age, same age as you. And I really liked the way you spoke as a child that children are not involved in matters affecting them. But I really need to bring to attention that in as much as we focus on how children will be in the future, we need to know that they're also people now and they have lives to be taken care of now. So I'd like to present to you a question from Nuru Abdulaziz, who is in Tunis, Tunisia. She says that children living in slums and poor backgrounds need to be involved in activities that build them, such as sports, arts, music, and talks. And I think you mentioned something about that. But these children living in slums tend to miss out. And nurturing is the best way to help them grow. So lack of trainers and training facilities keep them from exploring their talents. They feel a little bit different from children who are well off and who have access to good schools and good training facilities for exploring their talents. So Nuru Abdulaziz asks, how can these children be involved in activities such that they do not feel neglected or unequal to other children who are from well-off backgrounds? I hope that is clear for you, Caroline. And the last question I have is to Dr. Najat, who spoke a lot about the mental well-being of children during this pandemic. And I have a question for you from Rauda, who is in Nairobi, Kenya, and she asks that a number of children face abuse from within their homes, from step-parents or even their parents. For example, there have been many cases of girls being raped by their fathers, their biological fathers, their brothers, and male relatives in general who live with them. So as people who witness this abuse, what are the measures that we can take to put it to an end? By we mean us as children. How can we protect ourselves from facing these problems now? Because now we're staying at home as out of school, and we are more vulnerable to violence in the homes. And we all know that homes are supposed to be the safe zone of children where they're taken care of and they're not neglected and they're not abused. So with that, with those 4 questions, I'd like to hand it over to Dr. Sheila so that she can coordinate the answering.
Okay, thank you so much for those questions and for being the voice of other children from different countries and Kenya as well. Maybe I'll ask the panelists to answer the questions in the order they were asked. So maybe Amaya, we start with you with the question.
Great. Thank you very much for that question. And thank you, Sheila. I'll be quite brief on this because it is a very important issue. But just to say that there are very strict ethical guidelines. So people cannot just come to a school and start to ask difficult questions. It is not allowed. So they are very important formal guidelines, ethical guidelines, and they are checked very carefully with government, but also with people who are specialists in checking that things are taken care of, particularly people who work in universities, who conduct studies all the time. And they want to make sure that first they're not doing any harm by asking these questions or collecting the information in a certain way. So one of the ethical conditions, or the conditions to allow research to be done with children, is that we must provide some sort of services to make them available in case a child or young person wants to come forward and talk to someone, or if information is provided and the researchers note that this is a serious issue, that it can even be taken forward to police. So it's a very tricky issue, obviously. It's not perfect, but sometimes you don't want the information taken forward. Sometimes the service that is suggested isn't perfect. So it's a very difficult thing, but ultimately nobody will come forward if there is no service to support them. So it's a kind of what we call supply and demand situation, that unless the services are available, you might argue that from an ethical perspective that there's no point in just finding out what is the problem. And this is something that drives us every day to look on both sides of the equation. If we're going to collect data, what are we going to do about it? It's not enough to just describe the problem. And your question's a really good question because this is something that's very important for collecting data, and it's something that's quite difficult to do very well. So thank you very much. And I'm sure other people on the webinar will have something to say about that. Thank you, Sheila. And I must apologise that I might have to sign off just now too. So thank you very much to everybody, and I wish you well in this last part. Thank you.
Thank you, Amaya. If you're signing off, we will send you some questions because we have a few other questions for you. And maybe you can make your closing statement then. If you want to make your closing statement, do you have anything to say before you leave?
You know, I don't think I will, Sheila, in the interest of time, because you have lots of people on the webinar who I'm sure will be able to make good comments.
Okay.
So, let's let it unfold. But thank you so much for the opportunity, and we'll be in touch, everybody. Bye for now.
Thank you, and we'll be back with you. So maybe we can quickly move on to the next question. Anis, I think you've had, if you can, you've just have about 1 minute to respond. Your microphone is off. Anis, your microphone, you need to unmute your microphone. I think he has a problem. Let's move on to Carol. Carol, you want to respond? And then we go to Dr. Najat.
For my question, as asked about the children who are living in the slum and them not feeling a bit left out and not being involved. I think that one has two dimensions to it, and I'll speak about both. One, first of all, like I mentioned, and also as Dr. Najat mentioned, children will participate also in relation to, it will vary really. The young people, their children who are on the move, most at home, not everyone is at home and happy, you know. So I think relative to where they are, we also have to consider what opportunities for participation are there. I would not wholesomely say that if you're a young child living in the slum, there is no avenue for you to participate in addressing ending violence against children. You can still be living in a slum area and be able to write stories, be able to inspire your peers who are your age and are struggling, who are anxious like you during COVID-19, who are depressed and are not sure what's going to happen out of this. So you have to look, participation is just not, are we also being on radio and TV like the children in the urban centers probably are. It's not just about being in the newspaper or maybe traveling for a meeting in the city center. It has to be, you have to look at it big, full picture, you know, whether it's in you writing a story that's going to inspire another young person in the slum, or whether it's in you trying to figure out what skill can I learn from my sister or brother while right now we're in lockdown, whether it's a cooking skill and you're just at home or you're just trying to help out, you know. So look out for what else can you do that will occupy your mind, that will take away the depression, take away the anxiety. So that would be my appeal to young children who feel, oh, this is something for those in the urban areas and not for us. Look at how else can you participate, through a story, through letter writing, through peer-to-peer support, and even through mobile. Your report is being used in Nigeria in states that are conflict affected in the northeast. You know, you've heard of Boko Haram in the northern part, but you find over 200,000 young people are using that. So it's not just about where you are and give up. No, you can still do something.
Thank you so much for that, Carol. Anis, you've sorted out your technology problem. Okay, you have 1 minute, and we then move on to Dr. Najat, for whom there are also additional questions. So maybe
I just want to respond that I think firstly there is need for awareness to be created amongst the parents about the importance of education. The parents, they need to be made aware that it's better for their families in the long run and for their children if they don't work and they instead go to school. Secondly, the intervention has to be done by the state. That it has to be ensured that all children, they go to school and no child should be allowed to work. If the families get their children to work because of poverty, then the state should intervene to help such families. I think almost every state has the resources to help families that need this kind of help. Thank you.
thank you so much for that, Anis. Dr. Najat, over to you. You can respond to Halima's question, then Declan will have a couple more questions for you.
Okay, because I have to leave at 10:30
Yes.
also.
Yes.
Just if I understand well, because many problem regarding the sound, it was about, child abuse within the circle of trust and mainly within the home and the family, if I understand well. And yes, I just want to highlight, because the question is, I think, before COVID and during COVID, we need to have a kind of two spots. What we know that children victims of abuse within the circle of trust and within their family is really very important. We have not the real magnitude of all that. Why? Because many children, because of the pressure of the families, because of the lack of child-sensitive complaints and reporting mechanisms, because of taboo, because of the fear of reprisal, because of the risk of stigmatization, many children are not reporting it. And you could have many forms of violence. It could be corporal punishment, it could be humiliating punishment, it could be sexual violence, it could be also exploitation. You have various forms. But you have also the fact that children are witnessing, domestic violence. And we know that many women are beaten and victims of violence. And this also impacts not only, at the moment, but have a long-lasting impact on their development and including their mental well-being. And due to the COVID that make all these lockdowns and impossible to access to child helpline or to access outside, children have no solution to escape. And to answer to that, some countries in the north, but also in the global south, strengthen the child helpline to make sure that they are working. They also include home visits with having some social workers, and they allow also the fact that you could have a kind of transitional space when children and women who were victims of violence can be protected. But regarding, violence, domestic violence against children, or children experience domestic violence, I think is one main big point, really, and we need to deal with it in a very intensive way. And to come back to what was telling Caroline, I think the best way is also informing and empowering children to explain that they have not to feel guilty, that this is a violence, and also to provide them with good information, what kind of place they can reach. And this is really important, just to respond very quickly. And another point is also regarding how we can have parenting, really encouraging positive discipline and helping some parents who were not abusive before the pandemic, but due to stress and so on become. And this is important to have this parenting, the guidance and social protection included in the responses to the pandemic. Over to you.
Thank you so much, Dr. Najat, for that. I think we will give Declan an opportunity now to ask a few questions first to Dr. Najat and let her answer the questions. Then we can continue with other questions for the other panelists. Yeah. Declan, over to you.
Thank you very much, Dr. Sheila. I will ask Dr. Najat because I think she running out of time. So I'll sort of ask you two questions in one, but more or less these questions can also be attempted by the other panelists. So the question is, what are some of the immediate measures that can be taken to reduce cases of gender-based violence, which are rapidly increasing during COVID-19 period? And I think you alluded this to your presentation. And you can share with us some of the ways that can be used to promote, for instance, mental health concerns to the girls, to girl child, especially during this period. And the second question is, from where you sit, and the reason I selected this question for you is because of your particular role. You've noticed that there are lots and lots of beautiful reports that are actually written as far as, let's say, violence against children is concerned. But most of these reports, a lot of times, gather dust, and they're not, implemented as they should be. So how can we overcome this problem? To you, Dr. Najat.
Okay, you are asking me mainly regarding the second question, a big point, but I will start with the first one. Regarding the immediate measure regarding gender-based violence, and including against women, against girls, but also against boys and all the transgender and LGBT. We have to be very careful about what we are telling. And we know that in many countries you have this problem. And the what was highlighting, this COVID, because due to confinement and due to it's exacerbated, really the violence against children, domestic violence and gender-based violence. What we can do, and I think it's not only due to COVID, it was also before, and we have to be very careful to not, use this. It is exacerbating, it is giving more visibility, but the main lessons learned, and it's linked also to mental health. What we saw, if we are not seeing, health, mental health, education, child protection, child participation as a core responses, really, and the core and central and multi-sectoral responses to all these big issues related to various forms of violence to children, we are missing. It's what the COVID, and I think we need to use it also as an opportunity for learning, because they realize, many states and many civil societies, that one, if mental health is not included in the response, and mental health, it's not, we have not to wait children or women presenting, mental big problems. It's a problem of mental well-being. And this is important, how we can embrace and include mental health and mental well-being in the whole responses. It could be included within health, but it could be included within social protection. It highlights also regarding this pandemic that you have the countries, and many when you have gender discrimination, when you have social disparities, and when you have many big problems, including socioeconomic disparities, it is increasing. But it's not only a problem of poor families, it's more worldwide. We have to be very careful regarding that. And what it's important, and we come back again, and it is why, and it's linked to my to your second question, it is why, since I arrived in this mandate, it's 1 year ago, telling that children are not dividing, within UN, within systems, within. And the main important thing is not providing reports or guidance, or it's overwhelming. What is important, when you provide something and you want to be sure that it's implemented, you have to think how it is reaching children where they are living and growing, and to switch from this approach, top to bottom, but to switch like that. I think it's important. The other point, what is important for me, and I am using the country visit and all that, to be more and more practical, pragmatic, and to build on the existing responses. And when we are speaking about the front line, and to invest in the front line at local level where they are, and front line is composed not only by the professional, you have teachers, social worker, but you have community leaders, you have peer-to-peer, you have local authorities. And I think if you are not empowering that, and if you are not building on that, I can provide you an example. It's a pity. You can ask some countries. I am from Morocco, and I know that you have many challenges. You can, when we are speaking about, for example, access to justice, it's not only about penal and administrative justice, it's also about social justice. But for example, it's not asking states to build a wonderful building and you have no human resources. And what is important, what means child sensitive really justice. It means how the justice can come, and it could be by training, you know, we need to be very innovative, and and what I saw, and I want to share it with you, during all this COVID, we are still producing a lot of guides, a lot of things, and I am not sure that it's reaching. We become a little bit overwhelmed, and I think, you know, we need to be pragmatic, and for me, the local level and national level have a big role in, in this issue, and to tell this we have to do. And this webinar, I think, for me, what is important is to confront, you know, the practical workers and the practical issues, context specific issues, with all this wonderful concept and report. Because if we are not being pragmatic and embarking and having solution oriented, and it is why I'm telling, by listening to the front lines, those who are working each day, and children themselves, I know, because I am coming from grassroots organization. We learned a lot, and it is feasible. Our main challenge is to tell it is possible. Thank you. Over to you, Sheila.
Okay, thank you so much.
I have to leave, so sorry, because
Yes.
I have another meeting. Many thanks to all of you, and I hope seeing you soon. I shared with you the link regarding the agenda for action. It's in many languages, and it's very clear. Many thanks to all of you, and sorry for all this disturbing.
No, we really truly appreciate your presence and for making the time to join us and talk about the roadmap. So we truly appreciate you. Thank you so much.
Thank you.
Thank
Bye-bye.
you. Bye.
Bye.
So, Declan, where are the others? So Carol and Anis, I think there's a question. Declan, where is Halima? I can't see Halima. Halima, do you have any questions for Carol or Anis, Dr. Anis?
Yes, I have a question. I'd like to, I'd like to direct the first one to, I'd like to direct one to Dr. Anis. Fatma Omar from Mombasa is asking that most children who face violence live in fear because of the people who are violating them, their parents or their caregivers. And Fatma is asking, how can these children report cases of violence without being afraid? How can they be assured that nothing will happen to them if they report these issues? Because most of them fail to report because of living in fear. And the question I'd like to direct to Caroline is on the issue of bullying, since she works more with the children in clubs and in clubs and schools. I'd like to ask her that Rauda is asking, a number of children who are being bullied are saying that this is the norm because they are not seeing anything being done about it. Bullying is a big issue that most children face from their peers. What can be done by the children themselves to protect themselves against bullying in schools and even in their homes by their peers? That's all.
Okay, over to Anis and then Carol.
I think it's an excellent question. Unfortunately, I don't really have a solution to the problem. There are countries where there are social welfare officers, there may be organizations which can help such children. But if you are unfortunate enough to be living in a country where these facilities are not present, then you have a problem. I think one solution could be to talk to some of the other family members, or maybe talk to friends or their parents, anyone who you feel can help you with in handling the situation. This is in case there are facilities that are publicly not available. of course, if there are such facilities, if there are organizations, then you will not have this problem. But if these facilities are non-existent, then I think your best bet is either to talk to some of the other family members, or if not family members, then your friends or their parents.
Thank you for that, Anis. Carol, do you want to take the next question, or if you have anything to add
Yes.
to this question, you can also do that.
Okay. On the question around the bullying, which was asked, and it being a big issue, I totally understand when a child talks about bullying and sometimes nothing being done about it. And maybe I'll share my own experience. When I was in school, as when I was in my secondary school, that's from around 13, I was coming from a primary school that typically was from the southern part of Uganda. I was moving to a city school for my high school. And us from the southern part of Uganda don't speak the way people from the city speak. So you get to secondary school and people will either name your accent depending on where you're coming from. And it was a bit unsettling for me because I'm coming from a school where it was normal. Like how I spoke never struck me as different or as, not the cool way to speak. And it took a lot from me when, for example, one child from a higher class told me to dance to my name while wearing gumboots. I felt that was very humiliating. But what I did instead was turn that around. And instead of feeling like, people are making fun of my accent, which they had a special name for, I'll actually show them I can still speak the way I speak. Whether or not I come from the south, that's not my problem. But I'll show them it's more about what I'm speaking than how I'm speaking, because everyone will always speak differently. So I think I would encourage such young people to know that even me myself right now, I'm working for UNICEF, but I've gone through teasing in school. So it's more of how do you come back? How do you bounce back? And then how do you use that to encourage other young people to not wait? You're not going to wait for a trophy because you are bullied or a big hug from your headmistress. No, at times it will be you yourself to make that conscious decision and effort that I won't let that stop me. So just that self-belief and knowing that if it's right, then you stand up for yourself. Yeah. Over to you, Sheila.
Thank you so much. Declan, do you want to come in at this point?
Yeah, probably. Yeah, I'm happy to actually ask a question from Professor Anna OBrien, based in Nairobi. Anna OBrien asked the question: have the coercive, increasing long sitting and studying hours that most children in the developing world have to bear with been included these days in the spectrum of violence that children often endure? So technically, all this workload that kids have to, cope with, has this been considered, within the spectrum of violence that children often endure? And this question can go to any of the panelists.
Anybody who wants to answer that question? The long hours that children, in many African and Asian contexts, we go to school for many, many hours, and the stress of that. I think that's what she's asking about, right? So,
if I've understood the question, it's about the long hours that children are working. Sheila,
yes.
Is my understanding correct?
Declan, can you clarify the question?
Yes, so technically it's the workload that the children face. So both long hours that kids have to work off school, and also a lot of, I think the reality, for instance, in parts of Africa is children face a lot of school workload. So has this been involved or rather considered within the spectrum of violence against children?
Firstly, children, they should not be working at all. So this is one, that they should not be working. But if they are working, then of course there should be regulations where they should not be having long hours. There should be more breaks. the duration of the work, and whatever work that children are doing, it should be work which is light work. It should never be hazardous. So, these are concerns which should be kept in mind when one is making regulations relating to children who have to work. And if the state decides that some children they can be allowed to work. Like, I'll give you an example. Like, for instance, lots of children they work in fast food restaurants in the West, in Europe, or in America. Like, you see children working in McDonald's or Burger King or wherever. Now, but so they are children who are working, but they at the same time are also going to school. And then there will be very strict regulations about the duration that these children can work. So I think the developing countries, they can follow that model also, that if they have to allow children to work, then there could be regulations placed.
Okay. Carol, do you want to add anything to that?
No, I think his Dr. Nisa said it all. I think Dr. Nisa said it all when it comes to the protection of children. Already working for children is unlawful. So I don't even know if I would even recommend it at all, because it's illegal. It's improper, But then always consciously looking at the best interest of the child. What are their rights? How do you protect them? How do you ensure, instead of trying to see how do we keep the children busy, can you rather invest that energy in over 18-year-olds, when you're outside that bracket? So I think Dr. Anissa has well summarized that. Yeah, that's all from me, Sheila. Thanks.
Thank you. Declan, do you have anything? Otherwise, I'd ask two questions. They may not be fully answered here. And we're also now getting to the end of the webinar. Carol, this question is if you have provided any links to the YouTube, to the U reporters, because there's a lot of interest in learning more about the U reporters. So you might say one or two words about it, and also provide links for young people who might want to participate in U report, and whether there is a U report in Kenya as well, where we are based, but for the other countries. And the second one is to Anis. I think recently in Pakistan, they've been you referred to it, very serious cases that were highlighted by the media of young children being domestic laborers being killed. Like one incident where a little child who set the bird, the owner had a bird in a cage, set it free, and that girl was actually battered to death. And I don't know whether the two are related, but there was some law that was being put in place, I think called Zainab Alert. How far has that gone? Because it's atrocious what's happening. So Carol, and then Anis, and then we'll wind up.
Okay. So like I mentioned, right now, to go to your report, you can just go to the Facebook page. I think that's the easiest way to become a your reporter. If you have Facebook, you just search your report global, then you automatically become a your reporter. And that is wherever you are in the world, whether Kenya, Tanzania, Uganda, across the world. You just search for your report global, then you immediately become a your reporter by sending the word join to them in the message bar. So just go to the your report Facebook page or your report on Twitter. I'll hopefully type that out and share with you, Sheila, then you can share with everyone after that. But then in specific countries where this is being done via SMS, and that's the 11 or so countries that I've mentioned, the 70 countries I've mentioned, 11.5 million people. Then you will find countries where there's a short code where young people sign up to do it via SMS or via WhatsApp. But right now the options are many. I think even for the particular age group of children and young people, you'll find most of them use WhatsApp than traditional SMS. So just so you know, just go to the Facebook or Twitter page, search for your report global, you'll see the WhatsApp number and use WhatsApp, or you can use social media. It's totally free. You're given useful information. Right now during COVID, there are messages that are useful just for even you to protect yourself. There are mental health messages shared at times for your own safety as well. So there's a full array of information you can access as well as participate. Yeah.
Thank you for that, Carol. Before we go to Anis, could you make your closing statement as well, if you have? Yeah, just come in, or less.
Thank you. Thanks again, Sheila. It's been a great opportunity to engage. It's been a very exciting conversation we're having. But I think for me, again, it's more of an appeal to mostly children, naturally, because this is something I'm really passionate about. And thanks to people like Sheila who mentored me, I'm where I am today. I think you have to really believe in yourself. If you believe in yourself, if you reach out for information, if you reach out for support when you need it, I recognize it's a very difficult time during this pandemic. You may want to participate, but you're not sure how, you're not sure why. But if you ask a friend, then you'll know. If you read up information that's useful, while also making sure you stay safe, I think it's important that even the adults as well, they believe in young people, they believe in their capacity to participate and create change, and just know that if we work together collectively, we can address the violence against children. That's all from me, and it's been a pleasure joining you all.
Thank you so much, Carol. Let's go to Dr. Anis, and you could just give an update on that, explain what it is and how far it is, and then also make your closing statement.
The ZAN alert bill, it was passed by the parliament. I'm unsure if it was signed by the president, because it has to be signed by the president before it becomes law. But as far as I can recall, it was passed by the parliament. Now, you have mentioned this other case where this child, she was violently assaulted by her employers for freeing a parrot. So yes, this is very unfortunate because their child died. So this case is now presently pending in the court, and this is where it is right now. The employers, they are free on bail, but the trial is proceeding. Now, for my closing statement, I will just say that I feel that if we have to eradicate poverty from our countries, then I think one of the best ways is to impose a ban on child labor. Lots of people, they oppose it because on poverty grounds, but I think this is the way it was done in the West, and there is no other way. So it has to uh, be a complete blanket ban on child labor, and this should be coupled with quality education. And if any state, it complains of lack of resources, then just look at the amount they spend on defense. If probably you don't buy one or two planes for your Air Force, or don't buy one or two tanks for your military, you can open 1,000 to 5,000 schools with that amount of money. So and then look at the amount of money. Lots of times these states, they spend on big projects like highways and projects that attract public attention. So it's not that our states, they lack resources. They have the resources. I think the priorities are lopsided, and I think it's for uh, civil activists and organizations like ourselves who need to put pressure on them that these resources of the state, they should be spent rightly and on the people.
Thank you. Thank you so much, Anis, on that. I think that's a good note to end this webinar, that it is not that we don't have resources. It is not that we don't have resources. It is prioritizing investment in children, in prioritizing protecting children, educating children. and making sure that we look after the health and well-being. And this can be done at different levels. We've had very distinguished panelists, and there's still many questions that remain, which we will post to our panelists so they can give us the written responses, and we will put this up on our blog, the Jaslika blog. So with that, I'd like to thank all our panelists, those who have left us already and those who are still here patiently till the end. I really do appreciate your participation, and to all those who have joined us from wherever they are to watch and listen to this debate. Like I've said, the questions that we've had from Professor Grace Booney, from Dr. Anna Obura, and so many others, Dr. Kirimi, that we have not been able to respond to, and many other young people and children. So I would again like to thank all of those who have contributed, either by listening in or with questions. You can still send us more questions if you wish. And we hope to see you next time. Our next webinar will be on August 26th, and we'll be looking at the issue of equality before law, looking at the rights of girls before the law. And I must say it is Carol who gave me the idea for that webinar. So thank you, Carol, for that as well. And I would like to thank my co-moderators, Halima. Thank you so much also for being the voice of children and young people, and Declan for your participation, and the team behind the scenes. Have a good evening or morning or afternoon, wherever you are. Wish you all the best. Thank you very much.
Thank you. Bye. Thank
Bye-bye.
you. Bye.
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 Thank you. Bye.